Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568. Phone number 408-687-1899. Anytime when you are suffering from any disease at any age, and you are desperate from the treatments and the results of the treatments with no progress of your disease and improvement, you can call me for the second opinion of your disease as well as of the prognosis. And what are the hurdles, why you are not curing? I can guide you about that one based on the natural principles. How the nature was curing before there was a medical science here. Before that, how the people were getting sick and getting cured by the nature itself. So that I can guide you according to that one. So those natural principles does not change at any time. They remain the same. Though our way of treatment has time to time changed, and we are changing many techniques for the diagnosis, many techniques for the treatments of the diseases, but even then, we are not getting cured. The hurdles are that we are not following the natural principles which the nature was following in its previous course when there was no medical science. So I can guide you about those principles and those way of curing of the nature. Let's come to the today's lecture. As I was discussing yesterday, and it was in between, and we have not completed that lecture, that the accessory symptoms we are to discuss today with the accessory symptoms, because sometimes a confusion arises. A confusion arises in the course of the medicine and course of the disease progress, why we are not improving. And not only that we are not improving, there are some other type of symptoms which we have not previously recognized in the history of the patients as well as in the history of the disease. So, for that, I would like to explain all these things systematically. When we prove any drug substance on any healthy human beings, not all the symptoms are proved, not all the symptoms exist after the application of that medications. Though there are some common symptoms which are existing in all the provers, maybe male, maybe female, in different countries, in different environments, but still something remains hidden inside that which has not come up when we are starting the proving of any drug substances. And most of the symptoms which were common in all the persons and all the provers, we take them as granted as the keynote of this medications. But when we apply that medication to any sick person based on these key points, and after prescribing that medication on the basis of these key points, though patient is improving, and we see that improvement, but still there are some other symptoms which were not previously in the history of the patient. Patients say, after taking this medication, I feel better, and some of the symptoms has already been proved, but even then we noticed that Patient says, "Oh, doctor, this was not the previous condition. This thing has come up new after taking this medications. Previously, I was not having this thing." So when patients say like that, he is indicating about some new things coming up in the system of the disease or in the system of the person, which was not previously existing. And then these new symptoms are known as accessory symptoms. And accessory symptoms. Now, there is again one cross sections, and we have to cross that. What's the right direction? What's the right indication for these symptoms? And what's the right name of these new symptoms? Whether they are related to the medicine given or they are related to the disease itself. Initially, when a patient says, "I'm feeling better after taking these medications," there's no question that the disease is improving, that the disease is not improving. Disease is going on aggravated because patients already says, and all the symptoms which were previously he came to the clinic, to the doctor, they all are improved. When they proved, then it means the medicine was right. But still, there are some other symptoms appeared on the system of the sick person which were not previously in the history of the patient. And even they were not existed during the proving of that drug. When it was initially proved from the drug substances to as a medicine. As I told you, the medicine means when we know exactly a substance, how it affects the human body. And how it affects the human body means what type of changes appears in the system of a healthy persons after taking these medications. That is the identification of the drug. That is the proving of that drug. That this kind of symptoms are appearing after taking these medications, and still there are something hidden inside the properties of the drugs, properties of that medications when it was applied to a sick person, because sick person is already having some disease symptoms, and on the basis of key points we have prescribed the medications which was covering all the symptoms of the patient. But though patient says that I am improving, I am improving, my health is good now, it means those symptoms are known as accessory symptoms of the drug, of that medication which was given to that. Suppose I can give you one example for that one. A patient is having 10 symptoms. When he came to the doctor, and on the basis of those 10 symptoms, the doctor has prescribed medications which are matching with all the 10 symptoms, and you give that medications. No doubt that medication will cover those 10 symptoms, but side by side, there are some other symptoms. Disease is improving, system is improving, but there are some other conditions and changes inside the system which were not previously existing in the patients. And those things are known as accessory symptoms of the drug. And these accessory symptoms were at that time not appeared during the proving of that drug. They were not stimulated to the maximum extent when it was proved on a healthy human beings. But when you give it to the sick persons, just like it has covered all those 10 symptoms, but it has some other different qualities, which are now being shown against that medicine. The body is reacting that no, 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 I do not need this thing. Whatever the symptoms were previously there, those are cured, those are improving. But some other accessory symptoms are over there on the system, indicates that these symptoms were not proved during the proving of that medications, because it was in healthy persons. Now it is a sick person. And when the medicine reacts with the sick person, there are some other condition reappears. If you are not having any mentality about anything, you are not having your own idea for anything, and someone comes and give you an idea, someone comes and give you an idea, and you like that idea and you work on that idea, and you feel better, yes, and you justify that yes, that idea is okay. But suppose if you are having your own idea and someone comes to you and he explained or he advocates his own ideas, which some of it is matching with your thoughts, and you say, okay, this okay, because I like this idea because it is matching with my thoughts. But still, you are having some of the thoughts, some of the feelings which are not matching. And with that reaction, that medicine is stimulated to produce something else to explain that, just like two persons are conversating anything, and ultimately at some points they are agreed with that one, but at some point they are not agreed with each other. And when they are not agreed with each other, then they, with the conversation, they come up to another level of discussion. And when there is another level of discussion, means a medicine is proving, is fighting with the disease symptoms, and it has cured most of the symptoms which were relative, which were similar to that one. Those have been cured, but still there are some other things which were not cured, which were not covered by these medications, and the medicine is trying to prove its efficacy. And in that way, mixing of two ideas brings up another thing, some other symptoms. Those are known as accessory symptoms of the drug. Drug has been evacuated. The drug has been stimulated to prove those things which were hidden at the time of proving. But now they are visualized. Other thing. This is up to that the accessory symptoms of the drug, which indicates to the physicians when you are doing treatment for any patients, and you have collected 10 symptoms, and those 10 symptoms your medicine is covering. But still, after covering these symptoms, there are still some other symptoms coming up after giving that medications. That indicates the accessory symptoms of the drug substance which were not proved during the proving of that medications. That was a healthy person, but now it's a sick person. Sick person is having its own qualities and qualifications. And most of the qualifications were matching with the medications qualifications. That has been eradicated, that has been cured. But some accessory symptoms are come up which were not matching, and which was also to come upon the systems if it is not being treated with this medication. Suppose if this medicine was not given, ultimately the disease has to progress. So this is one thing. This is known as accessory symptoms of the drug. After that, second questions, accessory symptoms of the disease. Why we teach physiology? Why we teach pathology? Physiology is the normal functioning of our body. There are nine systems working inside the body, and the nine system has their own curriculum, how they work, what they do, what they result it out, just like respiration, just like circulation, just like digestive system. All these systems are having their own curriculum, and they do that. This is known as physiology, a normal physiology and a normal standardization of health. Just like we calculate the blood pressure should be 120 by 80, the respiration rate should be 14 to 16 per minute, sugar level should be 80 milligram per 100 ml of blood, cholesterol should be maximum 200 milligrams. All these things are calculated and known as medical standard of health. So all these things we study in the physiological, that this is the physiology, that if a sick person comes, it means his physiology is changed. His normal curriculum of working or functioning for the normal life has changed because of the disease. And you have given the medications to relieve that one. So this is one part of the today's question, that the accessory symptoms of the drugs are proved, especially when there is a similarity of the medications, that the medication is covering the symptoms of the patient with which he came to the doctor, and he prescribed on those symptoms. On the basis of those symptoms, he prescribed some medications, and that has covered those symptoms. But side by side covering means bringing it into the normal physiological level. He was having high blood pressure, he was having a pulse rate 72 to 80, but it is having more pulse rates. Respiration rate was more than 16 per minute. So all these things he came with, whatever may be the name of the disease, maybe pneumonia, maybe tuberculosis, maybe typhoid, whatever it is. But it was having changed the physiology. That's why we go to the lab test and we get the lab test done, and then we verify it. Basically, the lab tests are the verifications. What we assume, that is known as clinical diagnosis. Patient says, we examine. What the patient said, we examine that, we verify that, and we make an idea that this may be this disease. We name that one. Ultimately, we name that one, that these symptoms are going towards the diagnosis or the name of this disease. But ultimately, again, we send the patient to the lab tests. Why? Just it's a verification. We do X-ray, we will ultrasound, we do blood test, we do sputum test, do urine test, stool test. These all are the verification. What we are saying, what we assume that he is suffering from that one. So this is all comes under physiological checkup. After that, we studied that what are the normal course of pneumonia, how it starts and how it progresses. Just like many time I told you, the disease producing organism, just like the fungus, just like the protozoas, just like the bacteria, just like the viruses, all the disease producing organisms are having a special affinity to affect the human body and to change the physiology of the person. They change the physiology of the persons, and what they change are the symptoms. When they change the physiology, we consider it as a symptoms. Not before that. Just like 98.4 degree temperature is a temperature, but we do not consider it as a temperature unless it goes to 99 or 100. Oh, he is having fever. Pulse rate 72 to 80 per minute, we do not consider it palpitation or anything or tachycardia. No. But when it goes beyond that limit, oh, he is having tachycardia. he is having bradycardia. Like that, when they cross the limit of physiological standard or level, then we consider them as a disease symptoms. So in this way, we study for all the different diseases. Why we name the disease? Basically, a natural way, there is only one disease. What is that one? That is this is not easy. Oh, he's having a disease. We do not know what the name of that one. We know he's a sick. He's a diseased. Means his something physiological level has changed. And that we consider it he's a sick. An initial stage. Even it may be mental feelings, just mentally he realized, yeah, I am not feeling well. Or if it's changing the physiological level of the person, and this physiological level is checked later on. Just I told you about the clinical investigation and then the lab test and the x-ray test and all that. Then we verify all these things. Yes, we said it is pneumonia. So now I'm talking about the accessory symptoms of the disease. How we can know that? If we know, just like the physiology I told you, if we know the normal curriculum of our body, that how it runs, what are the normal standard of the health, then and only then we can recognize that yes, it is now abnormal. It is now increasing the limit. And then we consider it has changed something in its normal physiology and considered as a disease. This is not easy. He is not feeling easy. But this is has different explanations depending on the symptoms it produces. And the symptom it produces ultimately at a length proves something. There is a difference between different sciences. The medical science, just like the modern medical science, unless they see any disease producing organism, they said the disease producing. We do not say the disease producing. We say all the organisms, protozoas, fungus, bacteria, virus, these are not the disease producing organisms. They are the fruit of the disease. First of all, something was wrong. That is why these things have come up at ultimate stage, and we check them and we find, oh, it's that bacteria, it's that virus, it's that protozoas, and then we start the treatment. Before that, the modern medical science says, no, 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 we do not know much about this medication, this disease, uh, unless they find it out any tissue change, unless they find it out any organisms like this one, they do not declare that we are capable of treating the disease. But as a homeopathic doctor, as a natural medicine doctor, uh, we we consider the disease. This is in the beginning stage when a person starts feeling, I'm not feeling well. That not feeling well has the explanation, that is the subjective symptom that only realized by the sick person, not by the other ones. Pathology is recognized by the lab, and all people knows about that one. X-ray is recognized by the doctor and technicians and all that. Then, but these subjective symptoms are the initial stage of that disease. This is which is only recognized by the sick person. And at that time, suppose if you go to the lab, get test done, all the test will come into normal standard. And the doctor will say, no, 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 everything is normal. You are not having disease. You need not to take any medications because your cholesterol is normal, your blood pressure is normal, your sugar level is normal. You don't need medications. because they are unable to prescribe any medications, because their medication starts only after they find out any organisms in that one, and that organism is at the end of the disease, at a certain, when the disease has passed a certain pathway. After that, these appears. All the persons has not suffered from the COVID-19. All the persons, even at living in the same home, they do not suffer from the one disease. Some of them, it, yes, contagious, we call the contagious, shots, contagious diseases, yes, sometimes people may suffer, but not all the persons in one family are suffering from the contagious diseases. Otherwise, all the doctors and nurses and tuberculosis ward, they should suffer from the tuberculosis. It's not, because it depends upon the individual immunity. How stronger is our immunity, and we cannot suffer from that kind of disease. So let's come to the main question, the accessory symptoms of the disease. We study this uneasiness, this disease, which is progressing. At what stage, we don't know. At what stage a sick person has come to the doctor. And at that time, he explains everything. And we noticed in his sickness, this is what are the pathway it has covered in the standard of health, whether it has changed the blood pressure, whether it has changed the pulse rate, whether it has changed the temperatures, whatever. These are the initial things. These are known as vital signs. We check all those things. If there be any change, we note that. In this way, ultimately, we prescribe the medications. Let's come to the point, the accessory symptoms we are talking about. On the basis of this thing, we prescribe the medication, or any doctor prescribe the medications. And after prescribing the medicine, we see that patient is improving or not improving. These two things can happen. Whether this medication improve the health of the sick person or may not be. Under those conditions, two things happens. One, this disease, if it is similar to the disease symptoms, it will cover some of the symptoms of the sick person, and the person will say, oh yes doctor, previously I was having nauseatic tendency, I was throwing up, but now it's not. But even then the disease is still progressing. Even then the disease symptoms are going on worst. How we can say that the disease is progressing when the patient say that previously I was having a nauseatic tendency and vomiting like that one, but now I'm not. It means he has improved to some extent, but we know the course of the disease is progressing, because now we have find out some other changes in the systems, and sometimes we find out some of the organisms which are existing now, they were not previously. Having cough, having pain chest, difficulty in breathing, and we say he is having pneumonia. We assume that, but we do not have the proof of that. We prescribe some medications. There is no chest pain. He is a little bit relieved from the respiratory systems, breathing, and all that one. But disease is still progressing, because it was not matching the actually disease symptoms. It was not covering the whole of the disease symptoms. And again, there come up pneumococcus or tubercular acid fast bacillus. On that basis, we say, oh, no, 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 no. Previously, when we checked this sputum, there was no pneumococcus, there was no acid fast bacillus. It means our medicine has not worked well. The disease is progressing, and the symptoms which were not previously are coming up in the course of the disease. And the course of the disease is that now we got the pneumonia, we got the pneumococcus. And on the basis of pneumococcus, we have studied that one. It is in our books now. We have studied that. Ultimate, what happens if a person is having pneumococcus, if a person is having tuberculosis, if a person has gonococcus, if a person has diplococcus or something like that, what is their outcome? Ultimately, if they are not treated by proper medications, what will be the outcome? Whether the patient will die, whether the patient will recover after certain time. Just like I told you, in the viral diseases, they have their incubation period of 4 days, they have their routine periods of 21 days, and after 21 days the viral diseases go off. There's negative. But whatever they have caused damages to the system, just like earthquake comes only for a moment, 1 2 3 minutes, not more than that. It's too much. But with these 1 2 3 minutes, many houses fell down. Many poles, electric poles have fell down. Many trees have fell down. Now, after 21 days, if you find it out, test it out, you will not find any virus over there. Then you will say, oh, no, there's no virus. My medicine is acting. But even if you do not take the medications, after 21 days, the same thing will happen. There will be no virus. But still, complications are there. What damages has been caused by that storm of virus within 21 days, if it is not recovered, if the medicine is not given for that one, ultimately that may take a longer period. Tuberculosis. We know that the course of the acid fast bacillus is up to 6 months, and that's why the doctor says, okay, you have to take the medications for 6 months, injections and whatever they are too. But ultimately, if the medicine is not given and it go on in this way, ultimately what will happen? Patient may die with the tuberculosis. Patient will increase in the symptoms. All those things we are recognizing, and this is known as pathology. Disease courses. How a one disease has changed the internal physiology of the person is known as pathology. Changed physiology is known as pathology. And changed pathology is different according to the different causative factors which produce the disease. Different causative factors, they produce the disease. Tuberculosis will change the lung substances in a different way. They will eat it up in a different way. Pneumococcus will change the lung substances in a different way. Typhoid will change the blood circulations and all those things in a different way. So all the diseases by name, because we have named now, names basically are not the total explanation of the disease. Diagnosis means the diagnosis of the disease are made only based on some important symptoms. Important symptoms means if there is a pneumococcus, we say, oh, it's a pneumonia. Until we find out the pneumococcus, we do not say declare it's a pneumonia. Oh, it's a acidophilus bacillus tuberculosis. Okay, unless you find out any type of bacterial, viral, fungal, protozoal, anything which can cause the disease, we cannot name the disease. And they are in the later stage, not in the initial stage. Just like many time I told you, the Vidal test for the typhoid, it becomes positive on 10th day. and a person is suffering from headache, from fever, malaise, weakness, indigestion, all these things are happening even the previous 10 days. Patient is suffering from that one. They have changed the physiology of the persons, but we cannot name this one. We will name only when there will be typhoid bacillus is detected in the blood, in the investigation of the lab. Before that, we do not. So that's why I said the diagnoses are made based on only few important symptoms of the disease, not the whole sum. Whereas the homeopathic doctors take up the complete history of the illness, complete changes they have caused inside the normal physiology of the sick person. And as a whole, the total is composed of the disease. So sometimes you see that there are different or multiple diagnoses in one person. Person may be having rheumatoid arthritis. The same person may be having heart problem. Same person may be having some eye problems. There are different things. So in this way, accessory symptoms are those symptoms which were not appeared in the initial stage when a patient comes to the doctor, and doctor has already prescribed the medications, and with which his symptoms are not proved. His symptoms are not going to be cured or toward the direction of cure or coming back towards the normal physiology. And it has increased. And those increased symptoms, previously there was no tuberculosis, the bacillus, there was no pneumococcus, there was no gonococcus. It means they came after our treatment. It indicates that our medication prescribed was not effective for the disease, and the disease itself is progressing. And this is the route, this is the pathway of the disease, that ultimately it will result in pneumonia, or it will result in the tuberculosis, or whatever it is the name. So when symptoms aggravates, increased, and bring up some new symptoms, that is known as the pathology. Pathology is increased, aggravated. Physiological level has totally changed when he comes to us, but pathological level has not recovered even after the second visit. It indicates that these are the accessory symptoms of the disease. How we can recognize that one? Because we have studied the course of the pneumonia, course of the tuberculosis, course of the gonococcus, course of the different diseases we study in medical colleges and teach to the students like this one, that if this is this thing will bring up this kind of symptoms if it is untreated. If it is not treated, ultimate the disease will go on this pathway, and this symptom will come after this symptom will come after this symptom, then ultimate, what will the ultimate resolution of the disease? What will be the result of the disease? that that we have in our books, that we have after the experiments, after repeatedly testing the patients, that pneumonia progresses in this way, tuberculosis progresses in this way, typhoid progresses in this way. So that route we know, what comes after what comes after what. And if it is coming like that one, what has been written in the course of the pneumonia or tuberculosis or diplococcus, whatever, it indicates these are the accessory symptoms of the disease. And it is an indication for the physician as well that my medicine is not working for this person and we have to change the medication. Whereas in the physiological level, previously I told you, when we see there are accessory symptoms of the drug, and drug is in our control, symptoms with which the patient came to us, we prescribe the medications in physiological level, and ultimately those symptoms were cured. But there were some accessory symptoms, and now we know these are the accessory symptoms of the drug. It means the drug is in our control and we can withdraw the drug, and ultimately the patient will be okay. But this condition, this second condition, accessory symptoms of the disease are beyond our limit. And this condition indicates the physician that you have to change the medicines because your already prescribed medicine is not covering the condition so far, and the disease is progressing in its own course. That course we know, we study in the medical books. And what disease progresses in what way, just like nowadays cancer, AIDS, many other things, ADHD, all these things we know about that how these diseases are progressing, and if they are not controlled, what will be the next step of the disease, what will next come up into the disease, how the physiology will be changed in the next step if they are not cured, if they are not improved, if they do not get a proper type of treatments for that one. So these are the some indications of the accessory symptoms. Second thing, why it happens? Question arises, why it happens? There is a natural formula, natural principle, you can say. Every weaker dynamic affection, these are the affections. This is not the material things. Affections. Every weaker dynamic affection, because living thing in our body is immaterial, invisible, and that is power. We consider it power. The same way, there is a power, malarial parasite that cut your body. Ultimately, malarial parasite is gone. His toxin is changing our vitality. His toxin is changing our physiology. So that is the influence of that one, which produces shivering, which produces fever, which produces sweating, and all that one. Same way, every disease, everything happens in this way. So I'm talking about that a weaker dynamic affection. This is natural principle. Weaker dynamic affection is completely extinguished by the stronger one when both are similar in their nature and different in kinds. Similar nature means they can affect our physiology in the similar way as the malarial parasite was affecting our vitality and changing our physiological level. And now, to cure that one, we need something. We do not need that, okay, give him another mosquito, give him another mosquito bite. No, we do not do that. We give the medications. And a medication we give on the basis that which is capable of producing the similar type of symptoms: shivering, fever, sweating, all those conditions which are the malarial condition which were produced by the after biting the malaria parasite. So when both are similar in their nature, means they are capable of producing the similar symptoms and different in kinds. That was mosquito, this is medicine. Suppose everybody knows about the quinine. Quinine is given for the malaria. Mosquito bite, that produces change in our physiology and we say it is malaria. Now we give quinine. Quinine has the same capability of producing similar type of things, and the stronger power of the similar types combat the previous one, and ultimately now there is no bacteria and no virus, no malarial parasite. We have taken care of that one, and we are using protection from that one. So know that one. So ultimately, that will be cured. System itself has a responsibility to run its normal course. But whatever was coming up by the malarial parasite has been taken care of by the different kind with similar capability, with similar power, Puneet, in this way. The second thing, suppose if the medicine we are prescribing is dissimilar, this is, I'm saying, the similar. If it is similar, it's okay. If the medicine we are giving forces, suppose a person is having pain abdomen. I'm just giving you the example. A person is having pain abdomen, and you prescribe any painkiller without knowing what is the cause behind this pain abdomen and how it will be recovered naturally. Natural recovering means if you eat something which is not digested in a normal way, it may cause pain. It may be obstructed somewhere in the intestines. It may cause bloating. It may cause gas formation. It may cause pain and all that one. What is the normal course? Physiology. We study physiology. We teach physiology that every substance has a different course of digestion. For every substance inside the body, different enzymes are produced to digest things. Suppose if you are carnivores, eating something carnivores, meat or something like that, one different enzymes are produced to dissolve this meat. If you are herbivorous, you are taking vegetables, this and that, different enzymes are produced inside the body to dissolve that one, to digest that one. But something has gone wrong. Something has gone wrong inside your body or by your food. It was of different nature. That is, those enzymes which were required to digest this thing were not produced over there. Maybe a problem in the in your physiological system. Maybe the food is totally changed and the body was not adjusting that one, and you have the pain. And you have the pain for that one. For that one, dissimilar. I'm just talking about the dissimilar. First of all, I talked about the similar things, but similar thing indicates that we have to withdraw. Though there are accessory symptoms, but we have withdrawn the medication because it has already done its course and disease is cured. But now we are talking about the dissimilarity. So what you do normally, what happens in a routine? You go to the doctor and they give you painkiller. Okay, you have pain abdomen. Okay, take this one. And ultimately, that medication numb your nervous system. The telephonic connection, you can say, it is not sending information from your abdomen to the brain that something is wrong over there. And ultimately, you do not feel that. Suppose if my telephone line is disconnected, how you can listen me? You cannot. And if you cannot listen me, it means telephone connection is cut down. And all the painkiller medications are doing one or the other way, disconnecting the brain from the local area. But there are two type of muscles. One accessory sensory muscles, one locomotory muscles. And at that time, sensory muscles are cut down by the painkillers. Sensory fibers are disconnected, or you can say they do not perform their duty, they are numb. Okay, so they do not send the message to the brain, and nothing order is coming to from the brain, and everything is going on its normal way. And after some time, you feel better because it's not the credit to the medication basically, because the digestion was supposed to take place 3 4 hours. Maybe something has happened, change in the food, it may take 4 or 5 hours. And the medication has its effect on your body forcibly for 3 4 hours. And till that, you do not feel pain because the sensory function was disturbed. But after that, till that, locomotive function was normal and it has already digested the food, whatever was causing the pain. In this way, after the expiry of the function of that medication, you feel okay. And credit goes to that medications. But this basically the credit is not of the medications. A child is crying for milk and you are slapping him. How long he will stop? Again it will come up. Again, if the same condition comes up, because repeatedly he needs food, he needs the milk. Again, how many times you slap him? Ultimately, you have to satisfy him by giving milk. And if the food has changed continuously, you are changing time and again, and the person is suffering from the same thing, ultimately this condition will worsen. That medication will not work. The best example for this one is, suppose if there is a tumor, if there is a cancer inside the abdomen, in the intestines, and you are giving the painkiller, and this cancer or the tumor or anything else or the ulcer is not going to be recovered within 3 4 hours or 5 hours, then what? After 3 4 5 hours, again you need the medications. Again you need the medications of the expiry of that one. So that, because that was not the proper treatment of that one, and that was the dissimilarity. This is known as dissimilarity. What the demand of the body was not satisfied, was not properly taken care of. That is why these pains are coming. And if the patient, if the medicine is given to cure that ulcer, to cure that conditions, ultimately it will recover. It will recover, and that depends upon the different tissues involved. I told you many times that there are different kind of tissues. Four kind of tissues are there: bone tissue, nerve tissue, muscle tissue, epithelial. All these tissues are having their different repair time. That epithelial tissues are repaired within 3 to 7 days. Bone tissues are repaired within 6 weeks. So that time period is required to repair the damaged tissue. What type of tissue? Yeah, when you go to the doctor, you first question you ask doctor, what is the disease? Basically, disease is what you are telling him, and he has to just name it. He has to pick up a few symptoms and then name it. Oh, this is this one. But sometimes he has to give 2 or 3 diagnoses in one body. And ultimately, your second question is, doctor, how long it will take me to recover? Doctor is not astrologer. It is based on the technical experience. And the experience says that in whatever disease a patient is suffering, what are the tissues are involved in it? What are the tissues? Bone tissue. Suppose if person is having broken bone and he asks the doctor, how long it take me, doctor, to recover that? When he said 6 weeks, we will put plaster on 6 weeks, and ultimately you will be recovered. But there may be some complication. That's the second question. But ultimately, if there is sore mouth, the doctor will say, okay, take this medication, and within 3 to 7 days, it will be okay. But if it's not okay, normally it is, but if it's not okay within 3 to 7 days, it indicates some other complication things are complicating these things. That's why. And then we have to find out what are the causes behind that one and to treat that one. So in this way, this is the dissimilarity. This similarity give you temporary relief in every disease, in every condition of pain, because the pain is the shortest word used for explaining the disease. This is the shortest word used to explain the disease. After that, there is the explanation. What type of pain you have? I have indigestion, I have a gas, I have constipation, I have pain joints, this and that. This is the secondary explanation of that pain. But first thing is, When you go to the doctor, means pain. You are in pain. In whatever type, you are having pain. Pain may be serious, pain may be mild, pain may be just an explanation of diverted physiological conditions. So, in this way, the shortest word for explaining the disease is the pain, and it depends upon that one. So, I think today my lecture is over. I was supposed to start the joints, how this body is structured, and all the organs are joined with each other, mainly the this skeleton, bones, how the bones are joints with each other, what are the types of the joints, and what are their functions in the joints, how we can move the different joints. Suppose if we do not know what's the normal function of the knee joints, then sometimes we may may broke the things in spite of recovering those things. Most of the people go to the massage peoples for any pain or anything, but they do not know the structure of the joints. They do not know what is the function of the joints and how it moves normally. If they do not know, they will throw the joints this way, they will put the joints this way. Ultimately it may increase the conditions. So, yesterday, I will be giving you an explanation what are the types of joints inside the body and what are their movements, especially they can move on, so that we should know our body can move in what joint can move to what directions, so that properly we can use them even for the exercise and even for the normal go of life. We can use them. So today, my time is over. Tomorrow we will start with the joints. This is Gurdeep Singh Sandhu, your homeopathic consultant. And your phone number is 408-687-1899. Email address homeomedicine, HOMEOMEDICINE @yahoo.com. Anytime when you are suffering from any disease at any age, you can call me for second opinion. It's a free consultation. No fees charged for that one. And I can give you my best opinion based on my 52 years of medical practice. And you can get well soon if you know what are the causes behind your disease and you are able to remove those causes. Yes, definitely you will get well soon. So this is what I can guide you for that one. And even if you want to be treated with homeopathic system of medicines, a proper a scientific approach to your health, even then you can call me 408-687-1899. God bless you all. I pray for your health and will see you tomorrow, the same time, 5 to 6 p.m. 5 p.m. to 6 p.m. California Pacific times. You can join me on Facebook. You can join me on YouTube. You can join me on Sabarang radio stations and also the Pravaz radio station. Different times, on different days, different other radio stations join me to deliver these health education lecture series to their own listeners. So it's a free for everyone. Whosoever want to join with me, he can join me, and I can give this lectures to all those people who are interested to learn about the body, how this body is working, and how this body becomes sick, and if it falls sick, how we can come to know that what are the reasons behind that one, so that we can correct those reasons and get well soon. God bless you all. We'll see you tomorrow.